Today, I am directing all schools in Virginia to remain closed at least through the end of this academic year. And today, I signed Executive Order 53, effective at midnight tomorrow, to put additional restrictions on establishments that serve the public. Restaurants can remain open for carry-out, curbside, and delivery service only. All recreation and entertainment services, such as bowling alleys, theaters, fitness centers, or racetracks, must close. Personal care services that cannot adhere to social distancing, like barbershops, spas, massage parlors, must close. Non-essential retail establishments can remain open if they allow 10 or fewer patrons and adhere to social distancing and increased sanitizing procedures. Essential services like grocery stores, health services, and businesses in our supply chain will remain open, but they must adhere to social distancing and increased sanitizing procedures. And gatherings of more than 10 are banned. These measures will be in effect statewide for at least 30 days. We do not make these decisions lightly. Virginia is one of the country's largest and most diverse states, but COVID-19 is serious and we must act. Unfortunately, the virus does not respect national borders or state borders. It is now everywhere, or it will be soon. That is what happens when a global pandemic hits a nation. With this pandemic, states have been left to figure out this on our own, and I am acting to protect Virginians. It's important to acknowledge that there is no playbook for this. Every action affects people and their livelihoods. We are acting judiciously and with full regard for the consequences. It is clear that many of our non-essential businesses must close to minimize the speed at which COVID-19 spreads and protect the capacity of our healthcare system. The point is to limit the places where people gather in groups. We will be posting guidance for what is considered essential and what is non-essential on our website. This list is not exhaustive. You can expect it to change. I want to be clear, essential businesses will remain open. These are things like grocery stores, pharmacies, banks, and others. You will still be able to buy food and necessary supplies for you and your family. I also want to be clear about the expectations for essential businesses that remain open. Social distancing matters everywhere. So essential businesses that remain open have a responsibility to adhere to social distancing recommendations. You need to step up sanitizing practices on common surfaces. You can find more workplace guidance from the CDC, OSHA, and the State Department of Labor and Industry. Make no mistake, if you are essential and open, you have a special responsibility to do the right thing. To help make sure Virginians hear these messages about the importance of social distancing, we're launching a statewide communication effort, including targeted messaging on VDOT's highway signs. Now, let's talk about our schools. School closures are necessary to minimize the speed at which COVID-19 spreads and protect the capacity of our healthcare system. I know this raises a lot of questions for parents and also for our students. Let's start with the academics. I want to thank our superintendents, our teachers, and other school leaders who have been caring for the families in their schools during this crisis. They sacrifice every day in normal times, and they are providing a tremendous example today. I'm hearing stories about people doing reading lessons on YouTube, teachers calling parents just to check in, and volunteers showing up to help package food for our students. This is what it means to serve others, and I thank all of you for doing that. School division leaders will decide how students can learn the information they were meant to cover for the remainder of the year. By tomorrow, our Department of Education will issue guidance to help school divisions think through those decisions and ensure that every student is served equitably. We're already working on waivers to relieve testing requirements and ensure that our students who were on track to graduate can do so. I understand that for many families, these closures present practical considerations of who will care for children during the day now that they are not in school. These questions are especially pressing for our essential workers, such as our doctors, nurses, and first responders, our grocery store workers. These people keep our communities functioning. We have 1.2 million children under age 12 in our Commonwealth, and half of them are in public schools or preschools. A Yale study estimates that 80,000 of them may be the children of healthcare workers. So we need an urgent public-private response. Today I'm calling on our local communities, private daycare providers, community child care partners, and public schools to rally together to provide child care for the young children and school-age children of essential personnel. Our child care providers are also essential personnel. We must rally together to fill this pressing need across the Commonwealth while following strict public health protocols to keep our children safe.